Hey guys, Dr. Ken Gearhart here. Another video in our Back to Health series. This question that we get is what makes our office special? So why would a patient choose our office over another? There's lots of chiropractors if you come down 27. As I stated in one of our previous videos, I practiced for 16 years in Cincinnati and then moved my office over to Alexandria about 5 to 6 years ago. And I still have patients that travel from northern Kentucky as far as Walton all the way to Westchester to come see my office. So the question is, why would they do that? I feel in our clinic we go above and beyond what the average chiropractor does. I've spent a lot of time and money in researching and finding the best equipment for treating our patients. The first one is called a ProAdjuster instrument. It is a mechanical tool that helps me take a stress survey of your spine and tell me exactly which of your vertebrae need to be adjusted, which ones are moving properly, which ones are stuck or fixated. And then by using the tool itself, it's a little percussion tool or like a little jackhammer, it can gently adjust your spine for you. And I think this is important because a lot of patients, if they've never been exposed to chiropractic, are a little bit weary or concerned about getting their neck snapped or popped, as they say when they come in the office, and they're a little bit afraid or fearful of chiropractors. So this is a real gentle and easy way for me to bring people into chiropractic, start adjusting their spine, start seeing them get some improvement. And at a later point, if I feel manual adjusting is needed, at that point they may feel more comfortable with me and allow me to do so if we feel it's necessary. The second is our LordX decompression system. LordX is a non-surgical decompression table or an advanced form of traction. I was the first chiropractor in Cincinnati to start using this equipment over 15 years ago, and over the years we've had great success with it. It is used for treating herniated or bulging discs, sciatic pain, chronic or degenerative conditions. What I like about this treatment table is it allows me to move the table up or down so I can specifically target your area of concern. It's an advanced program. It's 20 to 30 visits. It works phenomenally for people with some serious lower back problems, and I'm glad we have it at our ability to use in our office. The third is a technique I learned called pain neutralization therapy, PNT for short. It is a soft tissue technique that allows me to break up chronic spasms in your neck, especially right around the top of your head or that suboccipital region for people that have chronic headaches. The technique itself affects neural reflexes and allows me to shut that nerve down to allow that muscle to start healing and calming down to release that pressure, and a lot of times that can help headaches. Over the years we've helped tons of people with serious and chronic headaches, migraine headaches, and sleep issues based upon this technique and doing some light cranial adjusting as well. The last technique that we specialize in is called Sound Assisted Soft Tissue Mobilization, or SASTM. It's a little tool we use to help break up scar tissue. Why this scar tissue is so important is because when you have a chronic area and that scar is there, it restricts blood flow and restricts movement in that area of your neck, back, or whatever region is affected, and that part will not heal. If we can use this tool to break up that scar, get some blood flowing to that area, the body can then heal again, and it works wonders on those areas. Another reason that I think we're special and why people come to our office is whenever I'm not here, the phone is always forwarded to my cell. I don't care if it's Sunday, Saturday. If you have an emergency and I'm available, call me and I'll come down to the office. Now there are times we are out of town, obviously, and we are not available, but for the most part, I'm available if you have an emergency, and we're always here to help you. Thanks for listening. Please share this video with your friends and family.